Now the fun part. Okay.
Oh wow,
Sit. Welcome to the office. Hi Natasha.
Hi.
Welcome to the office.
Thank you.
What you coming for?
I came in for my deviated septum.
Okay, let's talk about it. So the deviated septum brought you in. Who brought you in?
My mom.
Mom referred you in,
Yes.
Right? Because we're seeing your brother as well. And
Yeah.
brother's been doing really well. So happy about that.
Yeah.
Okay, so tell me about the septum. What's the issue?
There's some times when it gets a little cold outside that I can't breathe. It's a little hard to breathe, whereas this one like gets stuffed up and I'm like breathing through like one nose, or I just have to breathe through my mouth entirely.
The right gets stuffed?
No, the left.
The left gets
Yes.
stuffed. Yeah, I notice you have a piercing.
Yes.
Okay, did you notice this has happened after the piercing or before?
Before, it's been all my life.
Since you were a kid?
Since I was a kid.
Okay, did you hit yourself, fall on your head at all?
No.
Okay, all right. So that's what brought you in. But
Yes.
there's other stuff going on.
Yes.
Let's talk about it. What else is going on?
I have scoliosis. I grew
Okay.
up with it. I had scoliosis, and that's about it.
Scoliosis, meaning you were in school and they made you bend forward. They said there was a little bit of curvature in the spine.
Yes.
Did you ever get an X-ray or get it evaluated?
I did. I went to my doctor. So they told me to do swimming so I can like try to like align it and to make it like prevent it from getting any worse.
Okay.
And because I was growing up, so once I did finish rowing, it just stayed the same, which was moderate. It wasn't like severe to get surgery done.
You get any pain?
Not anymore. It was
Discomfort?
just more. No.
Okay. Anything else?
No.
All right. Okay. So let's do this then. Let's go over your X-ray.
Okay.
I need to kind of show you what's going on first, okay?
Got it.
And right now you're working, going to school?
Yes.
You're on your feet more, you're sitting more?
On my feet.
And activities?
Yes, gym.
Gym. Doing?
Pretty much.
Weight training, cardio?
Weight training,
Okay.
cardio.
More machines, more free weights?
More free weights.
More free weights. Okay.
Yes.
All right. You ready to get started?
Yes.
Let's do it. This is you, Natasha. This is a picture in time. It tells us how you've evolved from birth. 24 bones in the spine that move, 23 discs in between. This is your foundation. This is looking at you from the back. This is the right side. Okay? You know you had a little bit of curvature. I'm going to actually tell you where it came from.
Okay.
And what we can actually work on. Okay? This is your side profile. On the side profile, what we're looking at, three main things. Do we have the right curves? How is the posture? And what is the shape or condition of the discs? First thing let's do is let's just look at overall posture. And when we're looking at overall posture, this is our posture line or plumb line. This line from the lowest lumbar here, from the center, should go through the neck at C7 and C2. So what it shows us is you carry the upper part of your body behind the foundation. So these muscles here are kind of working overtime. I know when you're sitting or standing a long time, I know you get tight across it. Okay?
It does.
Yeah. So now you're going to see, guys, things will start to come out along the way. So that's number one. Posture,
Okay.
that's posture. That's something I'm going to go over what you can do to work on, okay? Curvature, if we're looking at overall curve, I'm going to move this aside. We should have a 60-degree curve in the low back, 40 or 60-degree curve, 60, 60, 40 to 60 in the neck. What's going on here? We have a little less curve in the low back. And what's happening, I'm going to zoom in to show you. Look. So I'd like to see a little more curve in the low back. It's a little too straight from 5, 4, 3, 2. From L1, it kicks back and it goes straight. So while it may appear to look like a good curve, it's actually straight through that mid-back. I'm not worrying about this X-ray right now.
Okay.
We're focusing here.
Yes.
Let me do this so we don't focus on that.
Okay.
Okay? So the mid-back is kind of straight through, and then what happens is because there's a sway back, your neck is starting to go in the opposite direction. Right now it's more of a straight curve, a straight neck, okay? But the body wants to do this, otherwise you're feeling off balance on your heels. Does that make sense?
Yes.
Yeah. So the idea on this X-ray on the lateral film is let's see what we can, is there anything we can do to help bring that curve or the spine forward and get more curve? And the first thing is, as I always look at tailbone to see if there's any old tailbone injuries, okay?
Yeah.
And the first thing I'm looking at is the sacrum here along with L5. When we're looking at the sacrum, I should see kind of there, I mean, there's little rough edges, but it should be a smooth curve going through. The first thing I'm seeing here is S5. So the coccyx goes slightly forward, S5 comes slightly back at the bottom in the tailbone. The next thing I'm seeing here is around S2. There, it's already starting to mature your tailbone, but there's a little bit of a break right there at S2. When I say a break, a disconnect.
Okay.
So I know we had a couple of tailbone injuries, whatever. You were a hurdler.
Yes.
Okay. I'm sure you had a couple of good spills
Yeah.
along the way. Now, there's something else that came up that I do have to mention. It's on this x-ray first. And there is what we call spina bifida at L5. And what that is actually, sorry, S1. And whether that was from trauma or whether that was from birth. S1, you see these bumps on the back here?
Yeah.
So the way they form, Natasha, is this. During development, they form, the laminas form those bumps on the back. Mm-hmm. Your S1 in the tailbone did not form completely. The right one lamina did, the left side did not. Mm-hmm. Okay, so my suspicion is you had a couple of good injuries as a kid. Typically with spina bifida is folic acid deficiency during pregnancy. And we're going to go over more details there in a second. Okay. So let's rewind. We have S5, S2. We need a little more curve in the spine. I'm going to explain where that comes from on the other X-ray, and there is good possibility for us to get that back. Okay. These discs are all good. These discs are all good. It's just in the neck we'd like to see a more forward curve. You're young enough. You can work on certain habits that I'll go over with you down the road. Okay. And they're easy enough for you to work on now. Got it. You're switching from a standing job to a more sitting, so it's going to be even more important. Mm-hmm. Okay, and I'll go over all that with you. Does that make sense so far? Yes. Do you feel what I'm talking about in your shoulders? Yes. Okay. Let's go over your AP now, and let's talk about the foundation. I want you to think of this, Natasha. This is your 24-story building, okay? Mm-hmm. And in order to have a stable building, we need a level base and foundation, okay? Yeah. Now, let's see what we have going on here. Do we have a level base and foundation? No, we don't. First thing we see is we have a rotated pelvis. It's rotating to the left side. So follow my process now. Your left pelvis goes down 1 but turns in. Your sacrum on the right, it's only 1 millimeter. I'm not so worried about that, but it's dropped 6 on the left side. Dropping more than a couple millimeters, it tells me there was some sort of tailbone injury. Now, here's what's interesting in your case. Right now you have a 2 millimeter, there's a 2 millimeter discrepancy between the left and right side. That's fine, okay? Anything under 7 millimeters adjustments will hold. But if I adjust the pelvis, the 2 millimeter will make it a little bit more. But if we work on the tailbone, it comes back up. So you did have quite a few things, okay, that you're not saying, and that's okay. So this is an interesting case, guys, because the working on the rotated pelvis will drop the femur head on that side, but working on the sacrum will bring it up again. So that's what's going to be interesting to see. We will need to work on the IN ilium. The ilium, the IN ilium, is what causes a more straightening of the lumbar spine. So if we want to get that curve back, it's going to be that IN ilium. I don't know that I'd start there though. Okay. I want to start on the tailbone because that's kind of the foundation of everything. Does that make sense? Yes. Okay. Now, as we go up the spine, what do we see? Yes, it curves to the left, but why does it curve to the left? It curves to the left because your base is off. So this isn't, you weren't born, you see it now? Yeah, I do see it. Your base is off here, 6 millimeters. Yeah. It's dropped with a little bit here. That's what's causing the curve. So whenever they checked you in school, you had injuries before that. So I mean, whether you remember or not those injuries, I'm sure Mama does. Yeah. Okay? You can ask her. So now watch, as it starts to go here to the left, what is the body going to do? It's going to compensate and come back to neutral.
Yeah.
But it doesn't stop. So all of this in the spine, I agree, this is all compensation to here.
Yeah.
Make sense?
Yes.
Okay, let's continue. But you came for what? Deviated septum. That's what brought you in. Do you get any jaw pain? Because you have quite a bit of jaw deviation. But if there's no pain,
yeah.
this is actually really important. There's two things that we look at, two things we don't touch. Asymptomatic knee, no matter how bad it looks on an x-ray, and whether the jaw is misaligned on the x-ray. If there's no pain, I'm not touching
There's
it.
no pain.
Okay.
Okay.
So I'm gonna leave it. Okay. Now let's get to the nasal septum for what you came in for.
Yeah.
Okay, let's look at it. This is the right side. Okay. Now she does have a septum piercing down low here, and we checked it out. We can still adjust you with it.
Okay.
Okay,
yes.
that's not an issue. But let's look at this. And you said you have more trouble breathing out of the left side. You can see a nice clear air passage here, right?
Mm-hmm.
But what happened here?
It's like.
It's a little block in there. So that's the side. That's what we got to look at there.
Mm-hmm.
Okay.
Yes.
Make sense?
Yes.
Any questions on the X-rays?
No.
You ready to get started?
Yes.
Let's do it. Let's go ahead and see, starting at the base of the neck. All right. You off today?
Yes.
Cool. And the first thing we're getting is upper cervical, 10 points, left side, C1, make that 12 points. And I'm just recapping, you said that it was the left nostril, right?
Yes.
So it'll be interesting because there is a connection between the upper cervical and breathing, okay? Mm-hmm. And you'll tell us before I even touch the nose after adjusting the spine what's different. Okay, as we're coming down, it seems that she has cord pressure. The needle is sticking all the way down the left side. Can you bring these down to here, please?
Yes.
I'm holding my finger right there. I don't want, right there. That's it, that's good. Is it okay if I hold it right there?
Yes.
Okay, you can let go. Okay. And there it is. So it goes all the way from the top, back, and it should go slightly to the right side for true pressure. Yep. That's true atlas cord pressure. So we have S3, S4, 5 down there. We have up top. Next thing we're going to do is static palpation. Okay. Static palpation, running our fingers. Is that okay?
Mm-hmm.
Cool. Static palpation, running the fingers through the spine, down the spine. And you can see the swelling all starts here. This is all inflammation. This side is okay. This side is more swollen. Okay, her left side. When I palpate the right side, the fibers are more taut. This side, it's more inflamed. Okay? All left side from left cord pressure. And then you can see switches to the right side there. Okay. Now let's check the pelvis. Feet together.
Yes.
Okay, and the way we're going to check it, feet together, open and close your knees with your feet touching, open and close. I'm checking general motion of the SI joints, okay? Right side only. Right side only. As she does the right, the left wants to shift with it. Left side only. Keep going. As she does the left, the right moves to right side again. Right there. Do you feel that right there when I push? When I push there, not so bad.
Yeah, not so bad.
Yeah. Okay, so this is left SI. Now we're going to go and palpate from the top of the joint. Come back slowly towards me. Top of the joint, middle of the joint, bottom of the joint. Which one is more tender to you?
The top.
Okay.
Yeah.
Top right there.
Mm-hmm.
That's the PI. Okay, sit up straight. Now, we're gonna go down in the tailbone, okay?
Okay.
S1, tender. S2, S3, S4, tender.
The S2, oh yeah, yes.
S5,
Ooh, yeah.
that's the one. S5, left pelvis. You follow me?
Yes.
She came for a deviated septum shoe. Sit back for me, please. Let's check the top. Okay, 7, 6, 5, 4, 3, 2. That's the one I feel there, left. Right there. Okay. That's 2. Yes. On the left, not so bad on the right. Okay. All right, young lady. So we have C1, S5, left pelvis. Stand up and you're going to do the walk.
Okay.
And I'm going to have you walk. Let me just tuck the back of your gown in, please.
Okay.
And if you can move the hair, you're going to walk to the end and back several times so you can see the walk, please. Just keep walking. Turn, keep walking.
Okay.
Normal walk. Look straight. Hold on 1 second.
Yes.
And move the hair. Okay. Walk for me, please. Turn, keep walking. Keep going. Sprained your ankles quite a bit. Hurdling. I'll work on that too, okay?
Okay.
One more time. Left SI joint's not moving as well. Okay, have a seat. Let's make a game plan and get started. All right, so what we're gonna do, we're gonna do S5, left atlas. Yeah, S5, left atlas. And then we're gonna do the septum. And I'm gonna work on your ankles today as well, okay?
Okay.
Cool?
Yes.
You ready?
Yes.
Let's do it. Sit back for me, please.
Okay.
And before I start the atlas, I want you to just breathe in through the nostril, through the left, and out, in. Which one's more blocked today? Not too bad, right? Okay.
Not too bad.
Ready?
Yes.
Okay, so left atlas, left ear down. Baby. Let's go. Take a deep breath in. That was a baby one. And I'm going to get comments because it should be a double clump going across the atlas, so we got to get a little bit more.
Okay.
One more. There you go. Stop thinking so much. There.
Ooh.
That's the home run.
Okay.
Stand up, please.
Yes.
Let's walk it off once over there. Much different.
Okay.
Breathe in. What's different right now? What's different from that?
Well, way up. Head.
All right. Let's go right side down over here, please.
Okay.
I like this table a little bit better, guys, because it's got the curve. You can get closer to the patient and stabilize a lot better. I'm right there, okay?
Mm-hmm.
Hold there. Be flexible. Okay. S5, let it roll forward. Ooh. That's the home run. Come on up. Okay. Walk it up. As you're walking, tell me if anything is different for you.
I feel like I'm not moving too much.
You feel what?
Like I'm not moving too much.
More stable?
Yeah.
A little less wobbly. Good. Okay.
Yeah.
Now, what you came for. On your back, please.
Okay.
So So people ask me, and it's really important, I want to share this information, right? That they come in and they're like, just crack my nose, or I just want Dr. Rahim to do my nose. And the work we do here is, as the sign says, in balance with nature. It's getting everything in balance.
Yes.
So while, your mom already told you, I'm sure, okay? She already told you. But typically, right, they're coming in, I just want you to work on this, or I just want you to work on that. That's not the work that I do. And I'm being very clear with people out there. If you want just that, you know, a la carte thing, this is not the place. This is for people who are looking to get everything back in balance. Okay? And it's a blessing. Why not? If you can, why not?
Yeah.
All right, now the fun part. left septum.
Okay.
Okay. Slide down a tiny bit. Okay. There you go. Now, piercing is there. Breathe in and out. Breathe in. Yeah. Okay, so I'm going to be holding there. Is that okay? Chin down all the way. And I want you to let the head go down. Down, down. There. You got to pull it over. Pull. There you go. Gotcha. I know. Breathe in and out. Mira. Poquito más, okay? A little bit more.
Okay.
Tiny bit. Chin down. Down, down. There you go. Done. Breathe in and down.
Oh.
Breathe in.
Yeah. Okay.
Let's walk it off. Walk it off once. Come over and have a seat. Let's check. Let's recheck. Make sure spine is clear. Head down a little bit. Look down a tiny bit. Neck is clear. Let's check down low. Sacrum is clear. Check it out. Back towards me. 5. Bueno.
Yes.
1. Bueno.
Bueno.
2. Bueno.
Bueno.
3. Bueno.
Bueno.
4. Bueno.
Bueno.
This is the one we adjusted. 5.
Bueno. Oh.
Look. Good?
Yeah.
Nice. Okay. Let's check the nose. Just to make sure. Now, I'd like you to do it. Go like this. What's different?
Can breathe in more.
It's a little bit easier.
Yeah.
You're going to have homework.
Yeah.
Best thing, easiest thing you're going to do, steaming.
Okay.
Okay, so pot of water. Boil the pot of water. Cover yourself with a sheet as much as you can handle. Let this stuff drain out. If you take that piercing out, you're okay?
Yeah.
It's not going to close back up right away?
No.
You've had it for a while?
Yes.
Okay. You mind taking it off for a couple of visits so you can do the steaming? If you want to steam with it, I'm okay with it.
Okay.
Okay?
Yes.
So I was able to get it, but just like the next visit, if you can take it off, see if we can get it a little bit more.
Got it.
Fair enough?
Fair enough.
Let's do the shoulders and continue on the ankles. Awesome. Shoulder. Drop it down, down. Let me do the work. Drop.
Okay.
There. Ankles. Let's go on your back. On your back over here, please.
Okay.
Cool. All the way back. And actually slide down with the pillow so your ankles are just off the edge. Okay?
Yes.
Bring your toes back as far as you can. This is the sprained ankle there.
Oh, yes.
Oh, yes. Okay. And we'll start just lightly with it. We'll use the board. Sound is the board, not your ankle breaking.
Okay.
AS talus, medial tilt. Posterior fib. There you go. Last walk.
Okay.
Good stuff. Check it out. Diferente.
Oh wow, I do.
Sí.
Yeah.
Let me tuck you in, please.
Okay.
Go back. Diferente. I want us to see me sitting in the tailbone.
Okay.
Okay, walk please.
Yes.
Dimples are moving.
Yes.
Ankles are more stable. Swing your arms please when you walk. Normally, walk normal.
Oh, okay.
Stop tripping. Cool?
Yes.
Have a seat.
Okay.
Alright. And last thing now, you get the buff and polish.
Okay.
It's vibration therapy, is to break up any scar tissue. And then we're all set for today.
Okay.
Vibration therapy, it's when it goes over normal tissue, it does nothing. When it goes over scar tissue, you feel kind of that little tickly spice.
Yeah.
And last thing, right over here, please.
Yes.
And let's check your hands. Face me.
Okay.
Squeeze my hand lightly. Squeeze. Squeeze. Elbow. Relax there. Lunate. Let it go. There. Scaphoid. Squeeze. Elbow. Identified.
No.
Elbow. Lunate. Scaphoid. Little more. Little more. That's it. Done. Squeeze. Go like that 5 times fast. Squeeze hard. Solid. Squeeze. Squeeze. Maybe a little more here. Relax. There you go. Squeeze. Squeeze. Questions for today?
Questions for today? None.
Welcome to the office.
Thank
You
you.
got it.